Hi, I'm Dr. Art DeCross. I'm a professor of gastroenterology at the University of Rochester Medical Center. Together with Dr. Marino, we're the gastroenterologists who were very invested in helping to start the hereditary cancer screening and risk reduction program. Our concern was primarily that organized medicine does not perform well at identifying your personal family history and how that family history is a risk to you and how it can be personalized to help you with your personal cancer screening. You see, the system in medicine does not allow the family history to automatically populate into your medical records. There are a lot of reasons for that. The computers really lack the sophistication to recognize, oh, your father had colon cancer. The computer is not going to automatically insert that into your medical record. And furthermore, privacy laws kind of aggravate the sharing of information between patients' medical charts anyway. So really, the identification of your family history is entirely in your hands. You have to know every cancer in your family, and that means, most importantly, your parents, your siblings, your grandparents, every aunt and uncle, and every cousin. Beyond that, you don't need to know family history of third cousins or great grandparents, but really what's a little bit outside the nuclear family. So the extended family, the people you might have over for a large family reunion or a large Thanksgiving dinner. And what you really need to know is the type of cancer that your relative had. You need to know the age at which your relative got that cancer, and you need to identify which side of the family that relative was on. So you need to be able to say that, oh, my mother's sister had cancer of the uterus at age 45. And you need to write everything down and bring it in with you, because nothing is more useless than when you go to a doctor's appointment and you say, oh, I think some uncle had some kind of cancer. That's not information your doctor can work with. The other problem today is that families are so much smaller. My grandparents used to talk to me about how they were one of 11 children or one of 12 children, but today the average family size is really just 2 children. And that means it's very hard to detect patterns of cancer in the family. Patterns are simply not obvious anymore. Anybody can detect a pattern if both parents had colon cancer and 6 out of 10 of your siblings had colon cancer. Well, then anybody can recognize that there's a problem there in the family with colon cancer. We have to be alert for different patterns of cancer, and that means we have to lump together the following cancers. We think about colon, stomach, and pancreas. We think about the gynecologic cancers. Some people call them the female cancers, cancer of the uterus, cancer of the ovary, and breast cancer. And then we think about the urinary system, cancers of the bladder and cancers of the kidney. All of these cancers can be potentially linked genetically. And you want to pay attention to, especially become concerned, are these cancers appearing in relatives younger than age 50? Are they appearing in multiple relatives? And are they crossing generations? So, a potential example of a concerning family history of cancers that seem to be unrelated could include a grandparent with pancreatic cancer at age 48, a parent with colon cancer at age 44, and a sibling with cancer of the bladder at age 35. Ordinarily, the average primary care setting is not going to identify that pattern as something of concern. So it is up to you to advocate for the significance of your family history, and that's really the message that we try to get out with the Hereditary Cancer Clinic, and that's what the genetic counselors and our nurse practitioners with certification in genetic screening assist you with in the hereditary cancer screening program. Thank you.